I'm about to tell you something that might sound strange at first, but I need you to hear me out. If you're over 65, sitting down to urinate could be one of the smartest health decisions you make. And I'm not exaggerating when I say it could literally save your life. This isn't about masculinity or convenience. This is about bladder health, prostate function, fall prevention, and cardiovascular safety, all backed by solid medical research. Today, I'm explaining exactly why more men over 65 should consider sitting to urinate, and the science might genuinely surprise you. Hit that like button right now. And drop a comment telling me where you're watching from, because what I'm about to share challenges conventional thinking, but it's information that could protect your health. Here's what most men don't understand. The way you urinate affects more than just convenience. It affects how completely you empty your bladder, your risk of falls, your blood pressure, and even your prostate health. My name is Dr. Jocelyn, and I've spent 5 years as a urologist helping men maintain urinary and prostate health. And one of the simplest recommendations I make, especially for men over 65, is to consider sitting to urinate, particularly at night. The biggest myth is that sitting to urinate is somehow less manly or unnecessary, but the research tells a completely different story. Studies from Europe and Japan, where sitting to urinate is more culturally common, show measurable health benefits, particularly for older men with prostate issues. Here's what the science actually shows. Men with prostate enlargement empty their bladders more completely when sitting compared to standing. Sitting significantly reduces the risk of dizziness and falls, particularly during nighttime bathroom trips. Sitting can reduce blood pressure spikes associated with straining during urination. And sitting is more hygienic and reduces bathroom cleaning for you or your partner. This isn't about judging how anyone chooses to urinate. It's about understanding that after 65, your body changes, and adapting your habits to protect your health is smart, not weak. In my 5 years of practice, I've seen men hospitalized from falls that occurred while standing to urinate at night. I've seen men struggle with incomplete bladder emptying that leads to infections and significant discomfort. And I've counseled countless men on practical strategies to protect their health as they age. So here's what we're doing today. I'm walking you through 5 specific reasons why sitting to urinate benefits men over 65, explaining the biology behind each one, and giving you practical guidance on when and how to implement this change, if it makes sense for your situation. And if you stay with me until the very end, I'm addressing the most common objections and explaining when sitting is most beneficial versus when it doesn't matter as much. Now let me walk you through 5 specific health benefits of sitting to urinate after 65. And if you're serious about protecting your health and independence as you age, hit that subscribe button right now because this information could prevent serious injury. Number 5, more complete bladder emptying, especially with prostate issues. This is the most extensively researched benefit. Multiple clinical studies show that men with benign prostatic hyperplasia, that's BPH or prostate enlargement, empty their bladders more completely when sitting compared to standing. Here's the biology. When you have an enlarged prostate, it creates resistance to urine flow. To overcome this resistance, your bladder muscle has to work significantly harder. When you're standing, your pelvic floor muscles and abdominal muscles are somewhat tense to maintain posture and stability. This creates additional resistance. When you sit, your pelvic floor muscles naturally relax. This reduces resistance, allowing your bladder to empty more effectively. Studies using ultrasound to measure post-void residual urine, that's how much urine remains in your bladder after urination, consistently show that men with prostate enlargement have less residual urine when sitting compared to standing. Why does this matter? Incomplete bladder emptying leads to increased urinary frequency because you need to go again sooner, higher risk of urinary tract infections, bladder irritation and urgency, and potential bladder damage over time. Emotionally, constantly feeling like you haven't fully emptied is frustrating and uncomfortable. Practically speaking, if you have prostate enlargement or frequently feel like you haven't emptied completely, sitting can significantly improve bladder emptying. One of my patients, 68 years old, was getting up 4 to 5 times per night to urinate. We optimized his prostate medication, and I suggested he try sitting at night. Within 2 weeks, he was down to 1 to 2 times per night because he was emptying more completely each time. He said, "Why didn't anyone tell me this years ago?" The key takeaway: for men with prostate issues, sitting helps you empty more completely, reducing frequency and discomfort. Number 4, fall prevention, especially at night. This is the life-saving part I mentioned in the title. Falls are one of the leading causes of injury, hospitalization, and loss of independence in men over 65. Here's the risk. When you wake up at night to urinate, you're often disoriented, your balance is impaired, your blood pressure may drop when you stand, that's orthostatic hypotension, and the bathroom may be dark. Standing to urinate in this state creates genuine risk. Add in the fact that many men strain during urination, which can cause vasovagal syncope, a sudden drop in blood pressure and heart rate that can cause fainting, and you have a recipe for disaster. Falls in the bathroom can result in hip fractures, head injuries, loss of independence, hospitalization, and in severe cases, complications that lead to death. Emotionally, the fear of falling creates anxiety and affects quality of life. Practically speaking, sitting to urinate at night eliminates the balance challenge. You can sit on the toilet in a stable position. If you feel dizzy or lightheaded, you're already sitting, you won't fall and hit your head. I've treated multiple men who fractured hips or sustained head injuries from falls that occurred while standing to urinate at night. One patient fell, hit his head on the bathtub, and required hospitalization for a brain bleed. He survived, but it was completely preventable. Statistics show that falls in the bathroom are extremely common in older men, and many occur during or immediately after urination. The key takeaway: sitting to urinate at night significantly reduces fall risk, which can literally save your life. Number 3, reduced blood pressure spikes and cardiovascular strain. When men strain to urinate, which is common with prostate enlargement, it triggers something called the Valsalva maneuver. You hold your breath and bear down, which increases pressure in your chest and abdomen. This causes temporary but significant increases in blood pressure, followed by a sudden drop when you finish straining. For men with cardiovascular disease, high blood pressure, or heart rhythm problems, these spikes can be dangerous. They can trigger arrhythmias, which are irregular heartbeats, dizziness and fainting, and in rare cases, heart attacks or strokes. Here's the biology. Sitting naturally reduces the need to strain. Your pelvic floor is relaxed, gravity assists with urine flow, and you're not using abdominal muscles to force urination. Studies show that sitting reduces the intensity of blood pressure spikes associated with urination in men with cardiovascular issues. Emotionally, knowing you're reducing cardiovascular strain provides peace of mind. Practically speaking, if you have heart disease, high blood pressure, or take blood pressure medications, sitting to urinate, especially during nighttime bathroom trips, is a significantly safer option. The key takeaway: sitting reduces cardiovascular strain, which is particularly important for men with heart conditions. Number 2, hygiene and cleanliness. Let's be honest about something men don't like to talk about. Standing to urinate creates mess. Splashing occurs on the floor, on the toilet, on your clothing, even if you don't notice it. For men over 65, particularly those with reduced dexterity, vision problems, or prostate issues that cause spray or dribbling, the mess can be significant. Here's the practical reality: sitting eliminates splashing. It's cleaner for the bathroom, easier on whoever cleans the bathroom, whether that's you, your partner, or a caregiver, and more hygienic. If you live with a partner, this can reduce friction and frustration. I've had countless patients tell me their wives were genuinely thrilled when they started sitting to urinate because bathroom cleaning became much easier. Emotionally, maintaining cleanliness and consideration for others supports dignity and respect in relationships. Practically speaking, sitting is simply more hygienic, particularly as coordination and aim become more challenging with age. The key takeaway: sitting is cleaner, more hygienic, and more considerate. Number 1, reduced after dribble and post-void leakage. After dribble, the involuntary leakage of small amounts of urine after you think you're finished, is extremely common in men over 65, affecting up to 40 to 50% of older men. It's embarrassing, frustrating, and can lead to odor and staining. Here's the biology. After dribble occurs because a small amount of urine remains in the urethra after voiding. When you stand, zip up, and start walking, that residual urine leaks out. When you sit, gravity helps drain the urethra more completely, and you can take a few extra seconds after finishing to ensure you're truly empty without the awkwardness of standing at a urinal. Additionally, sitting allows you to perform the milking technique, gently pressing upward along the underside of the penis to express any remaining urine in the urethra before standing up. This simple technique significantly reduces after dribble. Studies show that men who sit and use the milking technique experience much less post-void dribbling than men who stand and don't take these extra steps. Emotionally, eliminating after dribble reduces embarrassment and improves confidence. Practically speaking, sitting gives you the time and position to fully empty your urethra, significantly reducing leakage. The key takeaway: sitting reduces after dribble and leakage, improving comfort and confidence. Sitting is most beneficial at night. It reduces fall risk and helps you empty completely when you're groggy. It's also most beneficial if you have prostate enlargement or urinary symptoms, if you have cardiovascular disease or high blood pressure, if you have balance issues, dizziness, or orthostatic hypotension, if you experience after dribble or incomplete emptying, or if you're on medications that affect balance or blood pressure. Standing is fine during the day when you're fully alert and balanced. In public restrooms where sitting isn't practical or desirable, or if you have no prostate issues, excellent balance, and no cardiovascular concerns. This isn't an all or nothing recommendation. Many of my patients sit at night and at home but stand in public or during the day. That's perfectly reasonable. The key is understanding the benefits and making choices that protect your health. Your daily practical plan. Step 1. If you're over 65, try sitting to urinate at night for 2 weeks. Notice if you empty more completely, feel more stable, and experience less dribbling. Step 2. If you have prostate issues, try sitting during the day as well and see if symptoms improve. Step 3. If you sit to urinate, take an extra 10 to 15 seconds after finishing to ensure complete emptying. Use the milking technique if after dribble is a problem. Step 4. Make the bathroom safer for nighttime trips. Install nightlights, grab bars, clear pathways, and non-slip mats. Step 5. Discuss urinary symptoms with your doctor. If sitting doesn't improve incomplete emptying or frequency, medical evaluation may be needed. This is about adapting to your body's changing needs, not conforming to outdated ideas about masculinity. I need you to truly understand. How you urinate doesn't define your masculinity or your worth. What defines you is taking care of yourself intelligently, adapting to your body's needs, and making choices that protect your health and independence. Sitting to urinate isn't a sign of weakness, it's a sign of wisdom. It's recognizing that your body has changed and responding appropriately. You deserve to empty your bladder completely. You deserve to avoid falls. You deserve to feel comfortable and confident. And if sitting helps achieve those things, it's the smart choice. Hit that like button if this video gave you permission to make a practical choice that protects your health. Share this video with another man who might benefit from this information, because too many men are struggling unnecessarily out of pride or habit. Subscribe to this channel if you haven't already. I'm here to give you practical, evidence-based guidance that improves your health and quality of life, regardless of social expectations. And remember, aging well means adapting wisely. It means choosing health over habit, safety over ego, and practicality over outdated norms. Sitting to urinate is a small change, but it can prevent falls, improve bladder emptying, reduce cardiovascular strain, and increase comfort. That's not a weakness, that's wisdom. I'll see you in the next video. Take care of yourself, because you're absolutely worth it.